Member for Page.
Thank you, Mr Speaker. Mr Speaker, my question is to the Minister for Health and Sport. I refer the Minister to youth mental health issues present in the Clarence Valley and other communities. I thank the Minister for visiting my community recently, and will he advise how the government is taking action on mental health and helping young Australians reach their full potential, including in my electorate of Page?
The Minister for Health and Sport.
Thank you very much, Mr Speaker, and I want to thank the member for Page, who has a deep personal commitment to addressing and confronting issues of youth suicide, suicide in the community more generally, and mental health. It is, of course, a commitment which is shared by, and I say this in full confidence, every member of this House. One of the reasons why is that, of course, with 3,000 lives lost to suicide each year, that would represent more than 20 lives in each electorate. If you look around at each member, more than 20 lives. With 4 million people, though, who suffer from mental health issues, this is something which is present in every family, in every community, in every room. And so the member for Page's advocacy is something which is fundamental. We visited the town of Grafton because this was one town which had been hit by a particular series of tragedies, a series of youth suicides which have ripped at the absolute fabric of that town. Along with Pat McGorry, the member for Page and myself met with 4 families, 4 sets of parents who had either lost their children or, in one case, who had been suffering the legacy of an attempted suicide which would echo for the next 30 years. And what we saw, though, at the same time was a town that was determined to galvanise itself into action. Together, the people of the Clarence Valley, and in particular of Grafton, had put together the Our Healthy Clarence Plan. This is a plan which we were pleased to be able to support. Firstly, by announcing the first of 10 new headspaces focused on rural and regional Australia, where youth mental health and youth suicide have been such a terrible blight. I want to acknowledge in particular the Leader of the House, who played a very important role in helping to establish the Headspace program. So this Headspace was welcomed by young people in the community. At the same time, we also launched the fact that the North Coast Primary Healthcare Network would be one of 12 leading suicide prevention trial sites around the country. As part of that, there was $600,000 to be focused across the area, in particular on working with young people in schools, both pre and post suicides within their community, because what happens afterwards is about making sure that there isn't another loss, working with Indigenous communities. So these are all part of one of the pillars of our long-term National Health Plan, mental health and preventive health, 2 things which the Prime Minister has made signature personal initiatives, and I'm pleased that we've been able to give Clarence that sense of hope. I want to commend the members of the community, thank the member for Page, and galvanise the House to work together on youth mental health and on suicide prevention. Yeah.